Time. It's all about time. I didn't have the time. I had too many things to do in my life, like picking up my granddaughter from school. The doctor had told me that someday I would need to have my aortic valve replaced. But who has time for open heart surgery? Of course, that was before the elephant arrived. One day, he just showed up and sat right on my chest. I couldn't breathe. After a few tests, I found out I had better make time for surgery.
When I found out I had not one but two leaking heart valves, I just had the gut feeling that open heart surgery would take me out of commission. I manage a cattle ranch, I live alone, and I had to continue working. I didn't have time for a long recovery.
When someone has had either a heart attack or are not feeling well and are told, we need to fix your heart and that requires surgery, it's a major crisis in their life. They feel like they'll have to put their lives on hold and fight through a long recovery. That's not necessarily true with minimally invasive heart valve surgery. With this latest procedure and the latest technology, I don't have to crack the chest open. I go through the ribs, which can result in less pain, a quicker recovery for these patients.
I cried when I found out because I had already been through one heart surgery. But Dr. Dulab told me he could perform a different type of procedure that would be less invasive with a quicker recovery time. It was truly a miracle.
I felt completely confident in Dr. Dulab and his ability.
At the time, Dr. Dulab had never performed replacement surgery on two valves at once. Through this minimally invasive procedure, but on this day of my surgery, he said he had spent most of the night studying my films and planning my operation. He was willing to do it. I had complete faith in him.
I just loved my cardiothoracic surgeon. The whole team was great. My nurse knew what I wanted when I wanted it. Everyone was so attentive and pleasant. I felt like I was in good hands.
We want them to be able to return to their lives and families as quickly as possible. Our goal is to have them return with a heart that's working better.
After the surgery to replace my mitral valve, I was able to return to my normal activities much quicker than if I had been faced with open heart surgery.
The ICU stay varies from patient to patient, but most are discharged within 3 to 5 days. Oftentimes, restrictions are lifted and the patients are allowed to return to normal activity 10 days after surgery. The patients then participate in a 6-week outpatient rehab regimen. Most find the recovery time remarkable.
I woke up from surgery with two small incisions on my chest and two brand new heart valves. It was truly unreal how quickly I recovered from surgery. Once I left the hospital after about a week at home, I returned to life as usual. I was back out on the ranch tending to my cattle.
After my surgery, 4 days later, I was home. Unbelievable.
Every day I thank God for using Dr. Dulab's hands and talent to replace my valve. This is a hospital of miracles.
It has been more than 7 years now since my surgery, and I still feel great. That surgery has given me more time and a greater quality of life.
By performing the minimally invasive surgery, Dr. Dulab saved my future.
Dr. Dulab, the nurses, and the staff at Trinity Mother Francis gave me a great gift. They gave me back time. Time with my granddaughter, time with my family, and time to do the things I love.